The funds raised by the COVID-19 appeal were allocated to 14 members of the DEC, already active in 7 different countries. All countries where there is a critical situation already unfolding, only made worse by the COVID-19 crisis. The DEC selected Groupe URD to carry out a real-time review to promote learning and improve the ongoing response. The review, which began in October 2020, was carried out by a team of national and international consultants, both working together to collect and analyze data and organize workshops at national level. We are now going to present the few key elements from this collective learning process.
In many developing countries, the virus is having a silent impact as figures of number of deaths are not accurate. This is particularly the case in Afghanistan, Syria and Yemen, where humanitarian workers and community leaders have noted a significant increase in deaths not reflected in the official figures. The situation is different in other countries where the number of deaths is not as high as anticipated at the beginning of the pandemic. But the impact of COVID-19 over and above the number of deaths is considerable. The closure of health and family planning centers has had and continues to have a significant impact, for example, on vaccination programs, early pregnancies, and maternal and child health in general. Prevention measures, social isolation, economic difficulties, and the fears that these create for the future have had a profound impact on mental health. What is more, certain groups of people are affected disproportionately, notably in terms of protection. School closures, lockdown measures, overcrowding, the lack of activities and the lack of economic prospects have led to a general increase in the amount of violence against women and children. But the repercussions of the crisis on household economies and food security are even more worrying. There has been a significant deterioration in levels of food security in numerous countries. The measures taken to stop the pandemic, including the temporary closure of borders, the disruption of trade, the closure of private establishments such as shops and factories, the increase in unemployment and the reduction of cash transfers from diasporas have had significant economic and social consequences.
In this unprecedented situation, full of unknown factors, the DEC charity members and the humanitarian sector at large have had to adapt. They responded relatively well in conformity with commonly agreed standards on quality criteria in the humanitarian sector, including the CHS. The response has been by and large appropriate and relevant, adapting the practices to the evolution of the pandemic and the impact of the measures taken to control it. The decision to focus on health-related programs was related during the initial months and remained necessary in numerous contexts. These health systems have been profoundly destabilized. Supporting them, the recovery, and their teams to get over the crisis will continue to be essential. In addition, hygiene promotion, which is valid for a number of contamination risks beyond COVID, and the supply of basic protection equipment continues to be relevant for staff, health workers, and the population at large. However, the wide range of impact of the pandemic and the measures to reduce the circulation of the virus is having on education, food security, mental health protection is calling for an adaptation of the programs. It is essential, for instance, to support education systems in order to guarantee access to education despite the pandemic. Innovative teaching methods to prevent and reduce the number of pupils dropping out of school and to avoid subsequent negative secondary effects have been developed and deserve to be further explored. There is also an urgent need for gender-based violence programming and protection, as well as mental health and cash transfer for the most vulnerable. Particular attention has been paid to older people by some DEC charity members. In all countries concerned by this appeal, the DEC charity members already have had significant experience of working with local partners prior to the COVID-19. This proved to be extremely useful as the crisis underlined, once again, the added value of partnership between international organizations and local actors. But the process of the so-called localization needs to be pursued, accelerated, and refined, including a wider range of local actors beyond the NGOs. Local partners should be supported. Their central role in crisis response should be fully recognized. They should consequently have access to more financial resources and take part fully in planning and decision making, not simply implementation.
The way that the health crisis is going to evolve remains very uncertain. For the response to remain relevant, it is essential to adapt programs by analyzing needs as they evolve. The emergence and spread of variants of the virus could lead to a worsening pandemic situation, especially in African countries previously less affected by the crisis. What is more, the seriousness of the global economic crisis is becoming critical for many people in less developed countries and also for economies in developed countries. This could have a significant impact on the aid sector and possibly lead to reductions in humanitarian funding, which, in the current situation, could have tragic consequences for the most vulnerable people in different countries. Combined with other factors, including conflicts, these consequences could lead to the collapse of certain countries like Yemen or Syria. In this context, supporting local staff and organizations to reinforce their response capacities is essential for the close future, and also to prepare for other crises, possibly a food security and hunger one, and the looming perspective of climate-related crisis.